Right, so my name is Dr. Lucy Gately. I'm a medical oncologist and I work in the Alfred Hospital in the public sector as well as at Cabrini in the private sector, and work as a clinician researcher here in the personalised oncology division at WEHI. My interest in brain cancer research really stems from my early university days when I was first exposed to what the brain is and was quite fascinated by its structure as well as its complexity. And then through my medical degree and into my clinical years, I was drawn to oncology. And that's because I think it's quite a privilege to be involved in someone's life through what is a very difficult journey and to provide hope and certainty in what can be a very uncertain time. So it was only natural to then combine those two passions and start to work with brain cancer patients. And as I worked with brain cancer patients, the more I saw, the more I realised how much we didn't know and didn't understand, from the biology of the cancer all the way through to the lived experience of the patient. And it's what really formulated my plan for a PhD in survivors of brain cancer. So when the opportunity then came up to work here at the WEHI, I jumped at it. The dream of being able to sit with a patient one day in clinic and then take the idea and the knowledge into the laboratory and translate that into research that can have an impact on the broader brain cancer community could be a reality by working here. So I have two focuses for my research at the moment. The first is clinical registries. That's both in the collection of clinical data and the conduct of registry trials as an alternative to the conventional trial. And then the other part to my research is organoid-based research. So the first step to understanding anything about a particular cancer is to collect data on that cancer. So who are the people that get diagnosed? Can we understand a little bit more about that population? What are the features of the cancer when they're diagnosed? What's the location? How quickly it grows? How aggressive it appears? And then understanding the treatment options for a patient and how patients respond to that treatment. And so this is what formulated the idea behind BRAIN, which is my brain cancer registry, which is collecting all of that comprehensive clinical data on everyone diagnosed with brain cancer. From that, within that, we can conduct clinical trials, and we've actually done that already, and we've opened the world's first neuro-oncology registry trial here in Australia, which is currently recruiting at 18 sites across the country. Those trials are simpler. They answer a pragmatic, simple question that's important to the patient. My main focus of work is developing a personalised strategy for cancer. We know that if we can find the best treatment for an individual patient and we give them that therapy, that they will have a better outcome. Whether it be an improved quantity of survival, they'll certainly have an improved quality because they won't have the toxicity from ineffective treatments. We've seen it work before. The proof is in the pudding. There's many cancers out there that follow this approach. But what we need in brain cancer is something different to achieve that same outcome. The Brain Cancer Centre to me is extremely exciting. One of the biggest hurdles that I've had as a clinician researcher is I can come up with an idea that I know is important for my patients, but sometimes putting that into practice is quite difficult. And that's simply because I don't have that skill set. My skill set lies elsewhere. But if we can take all the bright sparks with all of their skill sets and strengths and combine them into one place, then we can set a fire that allows us to achieve outcomes for patients. And if we can support that through funding, through early career researchers, through fostering of relationships, then that fire can burn well into the future to continue to achieve outcomes.